Thank you very much for having me here today. A bit imposing, I must say. Most of you I've spoken to about research before. We've had the discussion around how much impact it can have to bring your consumers onto the stage and allow them to talk about the impact and the relevance that their work within the research has made. So here's my go at it. So as you've heard, lived with arthritis since I was 2. I've been lucky enough to be in remission since my mid-20s. But unfortunately, the consequence of being diagnosed at a time where we had no treatments for the disease is that I'm living with chronic pain every single day and will do for the rest of my life. Those of you that know the Godfather movies, you'll recognise the quote, "Keep your friends close, keep your enemies even closer." So I wake up in the morning in quite a lot of pain. A good day is that's the most pain I'm going to have for the rest of the day. Doesn't always work out that way. I'm not the most water-wise person. My hot showers do tend to go a little bit longer than the recommendations suggest. And every activity and inactivity for the rest of my day generally causes me pain. It's something that, as you would understand, I've lived with for as long as I can remember, so I've come to terms with it and I deal with it in the best way I possibly can. I'm also blessed, in a strange way, to be a little bit funny looking. That allows people to provide me with a little bit of understanding when it comes to my pain. Unfortunately, and if you understand the statistics, many of you in this room live with chronic pain every day as well, and I feel your pain. And that can be more impactful because it's invisible. And because of that, you get judged differently, you judge yourself more, and everything can be a lot more difficult because you have your good days and you have your bad days. And they don't look any different in the mirror or to anybody else. I was lucky enough to be able to run the STEPS program, which is a multidisciplinary pain management program in a primary care setting in a previous life. That gave me the opportunity to bring a team together and run education sessions for people living with pain. One of the things I learnt very quickly early on is that nobody wanted to see a psychologist for their pain. They had been told for most of their lives, or most of their lives with chronic pain, that there's a chance it's all in your head. And you get told that often enough, you start believing it. So the last person you want to see is a psych. But by the end of that program, when we evaluated it and we got feedback from our patients, it was clear that the most valuable consultation that they had was with the psych, because they gave them tools to help them to understand how to deal with every day of their lives. Another quote which has made the most impact on me, I think, throughout my life when I embraced it and understood it, was from a very clever man, Henry Ford. He said, "If you think you can, or if you think you can't, you're right." Now, most people use that quote to enforce the fact that you need to be positive about things, and you need to think you can, because if you can, you probably can. And if you can't, well, maybe you should think you can. But I look at it differently. If you think you can, you're right, that's good. If you think you can't, you're right, that's good as well. As long as you understand your body, you understand your mind, and you accept the way it is, you'll get through life a lot easier. And it's been an absolute privilege to work with Rob on this research project. It's made all of the experiences that I've had mean something, and it's also potentially helping other people to have better lives. And isn't that why we all got into this game? Over to Rob.
And right back at you, Ben. It's been just so gratifying and fun working with you so far, and it's actually early stages of our research, so there are many, many more fun times to be had, and not to cast too much light on a really serious problem that Ben's mapped out and put a human face to. We know that pain is highly prevalent, highly impactful. As Martin said, musculoskeletal pain is the most disabling condition worldwide in terms of the impact on lost productivity, lost participation, distress and suffering. And everyone here is touched by that in some way. But one of the huge impacts is the mental health burden. It's actually the norm to have mental health concerns when you live with daily pain, persistent pain. For psychologists who sort of see their role in mental health as treating the mind, actually more than half of the people presenting with depression and anxiety will also have chronic pain. The problem is lots of psychologists and mental health professionals don't have a lot of knowledge or confidence to work with people who have persistent pain. They don't know what the evidence is around best practice pain management, as you can see from some of the points in the slide. So there's a real kind of gap, there's a real translational gap in translating what we know works for chronic pain, which is a whole person-centred biopsychosocial approach, ideally with a multidisciplinary team like the one I work with here at Royal Perth Hospital. But access to that is really tricky. It's year-long wait lists, several years in fact, to see a pain specialist and to then see someone like me, a pain psychologist. So there's this gap, and one of the responses to that has been to try and upskill other professions, such as like Martin's work with advanced scope physiotherapy, for physiotherapists who can also address mental health concerns, and also online treatments so that people can access evidence-based cognitive behaviour therapy, for example, following e-therapy, ICBT. The problem is lots of people don't complete that. We offer that as an option in the pain clinic, but lots of people don't take it up or find that they drop off because it doesn't feel relevant. It's not person-centred, which I think Ben's given a really great account of how pain impacts everyone differently, and everyone has a different constellation of problems and strengths. So what we're trying to do is, upskill and provide resources for clinicians and consumers to better support the mental health of people with chronic pain. And so this is a blended care approach where we provide digital creation and make available digital resources, recordings, lived experience, video clips of people talking about the tools and techniques that have worked for them, worksheets and interactive modules. So I won't go into a lot of detail, but more to give that high-level overview of how we're trying to make this a translational project that really gets, a bit like Professor Novak was saying, that brings the bench to the bedside, that brings what we know works and makes it more available to people. And this is, I guess, a novel service delivery model, because we're trying to not cut out the clinician. We're still making this person-centred, clinician-involved care, but with a lot more resources for people at home, consumers to work through in their own time. So it's personalised. The clinician helps to personalise treatment based on an individual formulation. And so we're using an intervention development methodology, and this is just some examples of where consumer involvement is particularly relevant. We're doing some surveys asking consumers what their needs are, and also clinicians. We're forming a consumer advisory group to review the materials that we eventually create, and as well as getting them to be the face of those, recording their lived experience stories, and then eventually testing that with some SCEDs and implementing. And what we're trying to do, I guess, yes, again, great tee up that Professor Novak's given me for this, is that we're trying to embed this or create synergies with existing projects and work. Ben's also been involved with Pain Health. It's a funded, WA Health funded project to provide evidence-based information and some resources to people with chronic pain, and also a federally funded pain education training that's going to be launched next year, and particularly an AI-enabled version of that for young people. So we're trying to bring together synergies from other national collaborative research with various universities, but then partnering with consumers and clinicians. And just, I guess, as an example, I was kind of getting very excited hearing Professor Novak's talk there and thinking about how this is really what what I'm passionate about is clinician research and embedding that work, the research, in my clinical practice, trying to learn from clinical practice by talking to people like Ben and the patients I work with, and then also involving students. So we have placement students always who are clinical psychology trainees. I've got one currently who's involved in the surveys, creating the REDCap database for the surveys, and there's this whole new health workforce capacity building from that. I'm really, as you can tell, keen to get the future clinical psychology workforce pain literate. There's a real gap at the moment. So that's what we're trying to do in leveraging those synergies, and really wanting to acknowledge, as well as Ben's central input from a consumer perspective, co-creation perspective, my research collaborators and mentors from Curtin University, Professor Helen Slater and Peter O'Sullivan in particular, and also the support of RPH Research Foundation, because I think this embedded research is so important, and similar organisations like the RAIN Medical Research Foundation and Future Health Research and Innovation Fund, who have funded this clinician research fellowship that's making it possible. So thank you very much.